now we'll discuss on the most important topic. It is very important for upcoming nursing officer recruitment examinations, including AIIMS NORCET 11th. Here, so that is hemophilia. Here, the hemophilia also called as a royal disease. It is also called as a bleeding disease or a British disease. It is first seen in royal family. So that is Queen Victoria was carrier the first time. For that reason, it is called as royal disease. It is also X-linked recessive disease. Here, the males affected from this disease, the females act as carriers. Because males having the only one X chromosomes, for that reasons male are the sufferers. The females are having the two X chromosomes. The one chromosome affected for the hemophilia means another. So the healthy gene it produces clotting factors. For that reasons the females are act as the carriers. Now coming to the types of the hemophilia, the depending upon the clotting factor deficiency, the hemophilia is divided into the three types. The hemophilia A, it comes from the deficiency of clotting factor 8. Hemophilia B, it comes from the deficiency of clotting factor 9. Hemophilia C, it comes from the deficiency of the clotting factor 11. Yeah, so the gene affected in case of hemophilia, F8 gene is affected in hemophilia A, F9 gene is affected in hemophilia B. Now come to the clinical manifestation or the signs and symptoms we are going to see in the case of hemophilia. Here in India, so that is hemophilic, so the patients are very so that is high. Okay, so the data given by the hemophilic Federation of India in the world. So India has the highest number of hemophilic patients. Here the I. Okay, so for that reason, for the remembering, so that is signs and symptoms of hemophilia, just mnemonics that India. I is nothing but internal bleeding, because the muscle and the joint bleeding. So N is nothing but nose bleeding or epistaxis. So D is nothing but deep muscle bleeding or deep muscle hematoma. I is nothing but intracranial hemorrhage, and the A is nothing but anemia. The most important so that is complication in case of anemia is intracranial hemorrhage. Here now coming to the drug of choice for that is hemophilia, so that is desmopressin. It is a synthetic analog for that is vasopressin. It acts on the endothelial cells. So it helps for the release of the stored hemophilic factor 8. But in case of it acts only in the mild cases, but it is not effective in case of severe cases because there is no clotting factor. So for that reason it is effective only in case of mild hemophilic patient. Now coming to the role of nursing officer. Here the role of nursing officer is very important. The nursing officer should give a health education regarding to the disease condition and prevention of injuries or avoid trauma. Here the role of nursing officer is very important to avoid some of the drugs in case of hemophilia. So those includes aspirin, non-steroidal anti-inflammatory drugs as well as anticoagulant. So this is regarding to the small information regarding to this hemophilia. And also in India, the 7th April we are celebrating that is hemophilia day.